To begin, I want to emphasize that the risk of Ebola in Alberta remains very low, and the virus does not easily spread from one person to another. There have been no confirmed cases of Ebola in Canada or in Alberta, and I'm confident that Alberta is well prepared to deal with the potential case. In order to prepare in Alberta, we have worked with physicians, lab workers, hospital staff, and first responders. And we've informed them of the measures needed to safely manage potential Ebola cases. We've been aided in this with the terrific assistance of Alberta Health Services. Working closely with Alberta Health Services and our federal counterparts and other expert international organizations, we make sure that we have the appropriate safety measures in place, we monitor the evolving situation, and we make changes as required. Alberta Health Services has held and is holding more training sessions to reinforce with healthcare workers how to protect themselves. This includes hands-on training for healthcare workers in emergency departments, critical care, and EMS in all zones.
When healthcare workers in the Western world are being infected, that's a serious concern for us. We have had a couple of incidents where people who have been suspected have been transported. Some of our members have raised significant issues with the personal protective equipment that they have been issued, or rather not issued for that matter, when they have been denied some of the personal protective equipment because they've been told that it's not necessary, when they see that the procedures may be lacking. We need them to practice the procedures, because the procedures, having the time to actually practice these procedures is one of the real issues, because my understanding is that it's pretty critical that they are very, very carefully followed, and if they haven't had time to actually practice, the putting on and taking off, making sure that they are doing this step by step to avoid any contamination, then it adds to the risk. These people are going to be going to the next patient, they're going to be going home to their families, they're going to be going into their communities. We need to make sure that nobody goes into the community taking some sort of an infective agent out of the containment area.